Happy New Year, and welcome to the first episode of our 2021 Ask the Doc series, where live viewers like you, now on YouTube and Facebook, have the opportunity to ask questions of our experts in Alzheimer's and dementia research. I'm Chelsea Cox, your moderator for this series and Associate Director of Education for UCI Mind, which is part of a national network of Alzheimer's disease research centers designated by the National Institute on Aging, part of the National Institutes of Health. At the University of California, Irvine, UCI Mind is a collaboration of over 100 researchers and staff focused on solving Alzheimer's and related dementias. This monthly series aims to bring our latest research advances to you, our community, and allows us to answer your most pressing questions about dementia and brain health. And today, to kick off our 2021 series, I'm very excited to be joined by the director of UCI Mind, Dr. Joshua Grill, to discuss clinical trials and our advances toward new treatments for Alzheimer's disease. Welcome, Dr. Grill.
Thank you, Chelsea, and Happy New Year to our UCI Mind community.
Thank you for joining us. Over the past year, there's been a lot in the news about clinical trials and treatments, not just for COVID-19, but for Alzheimer's disease as well. And so I really do look forward to discussing this topic with you and our viewers. But before we delve in, let me take a few moments to introduce you, Dr. Grill, to our viewers. And I also want to explain to our viewers how you can be an active participant in this live discussion. So Dr. Grill is an associate professor in the UCI School of Medicine and the UCI School of Biological Sciences. As I mentioned, he's the director of UCI Mind, and he also serves as associate director and leader of outreach, recruitment, and engagement for our Alzheimer's Disease Research Center here at UCI. In addition, Dr. Grill leads the recruitment and retention unit for the UCI Institute for Clinical and Translational Science, and he serves on multiple national scientific committees. He is a widely respected Alzheimer's educator and researcher, having delivered hundreds of presentations worldwide, not just for professionals, but for community members as well. And at UCI Mind, he leads a productive research program focused on advancing recruitment, retention, ethics, and design of clinical trials across the spectrum of Alzheimer's disease. So Dr. Grill, again, thank you. It's an honor to have you on today. And if you are attending live right now, you might either be on Facebook, on YouTube, or you might be on our new Mindcast website. Welcome. You can participate in this Q&A with Dr. Grill on YouTube or Facebook by typing questions into the comments box that accompanies this video. Please do note that whatever you post on the internet will be linked to you and visible to others, so please do post responsibly. And I will go ahead and get us started with a few questions. So, Dr. Grill, since we're talking about clinical trials and treatments for Alzheimer's today, perhaps you could just start by explaining how the drug approval process in the U.S. actually works.
Sure. I don't think the recent experiences with COVID-19 are actually the best example for our viewers to think about how drug development typically would go, because the global COVID-19 pandemic really created a unique, obviously a extremely difficult situation for the world at large, and some unusual exceptions were made to how we would normally develop drugs. So for Alzheimer's disease and for most other medical conditions, we think of drug development as going through a logical process where we're learning and then confirming what we learned. And many people have heard the terminologies phase 1, phase 2, and phase 3 clinical trials, and those are still highly relevant for Alzheimer's disease drug development. We think of phase 1, or what we call early phase studies, as very preliminary learnings about how a drug works, how safe it is, how long it stays in the body or takes to leave the body, just how much of a drug can we give human beings without causing side effects that are unacceptable. After phase one, we'll typically move into what we call phase two. Phase one's often in healthy people, young individuals who are participating in these studies for the good of mankind and helping investigators learn about drug metabolism and the like. Phase two will often move into patients that we're actually hoping to help with the treatment that's being developed. So in our case, patients with Alzheimer's disease. In phase two, again, we're trying to learn about the safety of a drug especially, and make key decisions about how we're going to test that drug to see if it actually helps patients. And that is more often than not reserved for phase three, or what are sometimes called registration trials. Ultimately, it's only when adequate numbers of studies show that a drug is both safe enough and effective enough for us to use in clinical care would that then result in an FDA approval. And that is typically after phase three. And more specifically, it generally requires 2 positive phase 3 clinical trials in order for a treatment to get FDA approval. Again, we have to learn and we have to confirm. Science is replication. And so in most circumstances, even one phase 3 clinical trial that shows a benefit of drug is not adequate for that drug to be approved. And this has been the case in some recent drug development stories where there are open questions about just how much data is needed before a drug can be approved. But that should largely center around whether there's adequate evidence to support that the drug is safe enough for clinical use and provides a meaningful enough clinical benefit for the patients who will take it.
Okay, and you touched on this a little bit. 2020 was an exceptional year with the speedy development, approval, and administration of vaccines for COVID-19. And you mentioned that's not necessarily typical. So why then does it take? Why was it that could happen so quickly, and then developing a drug for Alzheimer's disease seems to be taking so long?
Well, I think that COVID-19 was highly unusual. The world was turned upside down because of the COVID-19 global pandemic, and so it just did create circumstances in which governments around the world committed themselves to trying to do something as quickly as possible about this. Importantly, governments around the world have also committed themselves to doing something about Alzheimer's disease as quickly as possible. But it's admittedly a more complicated situation. We don't have a single disease caused by a single virus. We've got a complex neurological disorder that affects tens of millions of people. And we're still trying to understand exactly what causes this disease and how best to tackle it with a treatment. And so we're learning as we go, and we're trying lots of different types of interventions, different drug targets. We have learned tremendous amounts about what happens in the brain of a person with Alzheimer's disease. And we're using that information to try to develop treatments that directly go against what's happening in the brain. But these things do take time. And only, again, not to repeat myself, but only when we have that adequate amount of data to support a new treatment as both safe enough for use and effective enough for use will we see an FDA approval.
So many of us have read and heard about the potential of a new treatment called Aducanumab to be the first approved to slow the progression of early Alzheimer's disease. Could you tell us more about that, and what's the status?
Sure. So you said everything, of course, correctly there, Chelsea, but it's important to remind people that we do have some FDA-approved treatments for Alzheimer's disease, a class of medications called acetylcholinesterase inhibitors that include things like donepezil or Aricept, as well as one drug, memantine or Namenda, that is approved in later, more severe stages of Alzheimer's dementia. So Adacanamab serves as possibly becoming the first FDA-approved treatment that can slow the course of Alzheimer's disease, or a disease-modifying therapy, if it is approved by the FDA. And it is currently under review by the FDA for potential approval, presumably with that indication as a disease-modifying therapy for Alzheimer's disease. and we expect a decision from the FDA sometime early this year. Most indications suggest probably around March. This has been written about substantially in the lay media. We've had blogs about it in the UCI Mind blog. This is something that is certainly captured the attention of the field because it too is a unique set of circumstances. Aducanumab is a monoclonal antibody against the beta amyloid protein that accumulates in the neuritic plaques of the brain of a person with Alzheimer's disease. And there have been a handful of clinical trials of Aducanumab, some of them even done here at UCI Mind. In early phase studies, it became clear that Aducanumab, if treated at high enough dose for long enough periods of time, could substantially reduce the amount of plaques in the brain of a person with Alzheimer's disease. And in those early studies, it seemed like there may be a similar treatment effect on clinical outcomes as well. And that led the sponsor of those clinical trials, the companies that are developing Aducanumab, primarily Biogen, to move right into phase 3 clinical trials. So they largely decided to skip phase 2 and began 2 parallel multinational, multi-site phase 3 registration trials that were extremely large and extremely expensive. The long story short here is that one of those clinical trials suggested that Aducanumab was beneficial for patients and the other did not. In the one that did not suggest a benefit, there was a suggestion that some patients, if given the full dose of the drug for an adequate amount of time, may have benefited. And Aducanumab was an application for approval was delivered to the FDA from Biogen based on those data. And that's what we're waiting to hear. Will those data be substantial enough evidence to support an approval of Aducanumab? And the FDA convened a committee to appraise the available data for Aducanumab at the end of 2020. It was a very interesting set of conversations, interpretations of data, discussion with clearly diversity of opinions about whether Aducanumab should be approved with the data that are currently available to it. And many experts who were convened as part of that advisory committee felt that the data was not adequate to support approval of Aducanumab based on the data that are available. I think that it's still an exciting time, regardless of whether Aducanumab is approved based on the currently available data. There's real indication that it is worth studying this. And just this week, we actually had announcement of a positive trial at phase 2 for another monoclonal antibody against beta amyloid. And so my personal feelings is that there is growing evidence to support that these types of therapies that reduce the amyloid plaques in the brain may actually offer a clinical benefit to people with Alzheimer's disease, be they people with mild dementia or people with what we call mild cognitive impairment.
Thanks, Dr. Grill. We have a few questions here from our viewers. One of the questions was just simply what is the spelling of the specific drug that we're talking about? So I just wanted to quickly share that on the screen. It's called Aducanumab and spelled Aducanumab. Hopefully I got that right. And then a question here, Dr. Grill, could an Alzheimer's patient in phase 3 still have a certain degree of memory and reasoning ability?
Sure. So I think we have to be careful about our terminologies here. When I say phase 3, I'm referring to the phases of drug development. So that's, how many trials have been conducted with a particular agent under study, and hopefully what are the goals of the clinical trial. Those are how we kind of describe the different phases of drug development. And patients, will have to qualify for a clinical trial based on whether they have the correct diagnosis, or in this case, whether they have Alzheimer's disease. But we also are going to have other criteria that a person must fulfill in order to participate in a clinical trial. And that would include the severity of their disease, and perhaps the viewer is asking about that. In the Aducanumab trials that were delivered to the FDA, for example, patients had to have what was called early Alzheimer's disease, meaning that they could have a diagnosis of mild cognitive impairment or a diagnosis of mild dementia. The difference being, in one case, a person has memory or other thinking problems that don't get in the way of activities of daily living, and in the other, they have memory or other thinking problems that do get in the way of activities of daily living or living your daily life. But they couldn't have moderate to severe disease, so they couldn't have a greater degree of impairment that really requires more help with living life on a day in and day out basis. There are a number of other criteria that are used in all clinical trials with the goal of really understanding who are we testing this drug in, how can we interpret the data that are collected as part of the clinical trial, and then how do the results of the clinical trial apply to the population at large of patients who are afflicted with this condition.
Dr. Grill, there's a question here asking, I think in reference to that phase 2 trial that you talked about, whether you were referring to Can you say it again?
Sure, Donanemab. And yes, there were top-line results announced by Eli Lilly and Company today about their monoclonal antibody, Donanemab. And the top-line results, we haven't seen data presented at all yet, but the top-line results were, in fact, that Donanemab could help slow the progression of disease as measured with a composite measure of cognitive abilities, thinking skills, as well as activities of daily living, specifically instrumental activities of daily living. So a little bit more complex functional tasks that people complete in their daily routines.
Another question here that I think is referring to Aducanumab, the other monoclonal antibody we were talking about. Is it only helpful for people with Alzheimer's dementia, or would it also work for cognitive issues associated with other dementias?
Yeah, so for Adacanamab and for Donanemab and for other monoclonal antibodies against the beta amyloid protein, we really don't know the answer to that question. We would expect that if those drugs are effective, they're effective because they're lowering the number of beta amyloid plaques in the brain. And so if a person's cognitive problems are brought on by beta amyloid plaques and perhaps neurofibrillary tangles, which are the two hallmark pathologies associated with Alzheimer's disease, then we would expect that those drugs could be effective in anyone who suffers from the accumulation of those pathologies in the brain. If the person's dementia or cognitive problems are caused by another pathology, if they've had a stroke or if they have frontotemporal lobar degeneration, I don't think we would have as much reason to expect those treatments to be effective in those populations. And I'm not aware of trials that are testing these monoclonal antibodies in other non-Alzheimer's disease dementias. But the only way we would know would be to actually test those drugs. And I don't think the rationale is really there to do that, but that's how we would have to find that. And it's perhaps important to say that especially led by work from our colleagues at UC San Francisco, who are leaders in studying and doing clinical trials in non-Alzheimer's dementias, there are some examples of clinical trials that include people with Alzheimer's disease as well as other causes of dementia that are characterized by accumulations of neurofibrillary tangles. And so questions like, can we treat neurofibrillary tangles regardless of the underlying disease that a person has? Can we treat them with a single agent? There have been some efforts to do that with some pretty interesting results so far, that the specific dementia really may matter to whether a drug is safe and effective enough for use, even if tangles are part of the pathology for multiple conditions.
A question from another viewer here. Might these drugs be used in lower doses to help prevent Alzheimer's before it occurs, if plaques are found, before the disease is present?
Yes, absolutely. And the types of clinical trials that the viewer is referring to can be termed preclinical Alzheimer's disease, or sometimes secondary prevention clinical trials. It is certainly the case that we have learned that the changes in the brain associated with Alzheimer's disease begin years, if not decades, before memory and other thinking skills show signs of impairment. And we are now in a new era of prevention clinical trials, or preclinical AD trials. We've been doing this for several years now. The first trial of that type was known as the anti-amyloid treatment in asymptomatic Alzheimer's disease, or A4 study. And A4 continues and will give results in the near future. It tested a different monoclonal antibody called solanezumab. We are nationally, we've begun a new preclinical Alzheimer's disease study called the AHEAD study, and it's going to test a monoclonal antibody being developed by Eisai and Biogen called BAN2401 that has been shown to essentially clear the brain of plaques if the dose is high enough and the drug is taking long enough. And that will position us to answer highly unique scientific questions like, if we get rid of plaques before memory problems begin, or if we prevent the plaques from even forming in the first place, can we delay or prevent the onset of memory problems in people who are at increased risk to develop them? So all of these clinical trials are enrolling cognitively unimpaired older people who are willing to have a brain scan and see if amyloid plaques may have begun developing in their brain. And if those plaques are present in the brain, can we intervene to try to do something about it and delay or prevent altogether the onset of memory problems? These are really important, complex clinical trials, but many people in the field believe that this is how we will ultimately have the greatest impact on the public health of Alzheimer's disease.
Sounds like there's always new treatments and new trials coming up and being tested at all different stages of the disease. If you are interested in staying informed and learning about these new studies as they do come about, I'd encourage you to visit our UCI Consent to Contact, or C2C registry website. The website is right here on the screen, and that's where you can learn more information and sign up to be contacted about studies that you might be eligible for in the future. So just wanted to share that resource with you. We have quite a few questions here, Dr. Grill. On this note of other trials that are happening across the spectrum of Alzheimer's disease, there was a question about whether there's any trials or drugs in development for patients who are already in the mid stages of Alzheimer's.
Yeah, there are certainly lots of clinical trials for people who already suffer from Alzheimer's disease dementia at various stages. And I think that, we believe that it's imperative that we continue to test improved treatments. We refer to Aducanumab as possibly the first disease-modifying therapy, and the field is squarely focused on finding drugs that can slow the course of the disease. But we need better symptomatic therapies as well, treatments that help patients perform a little better in their daily routine, or perhaps treat the troubling behavioral symptoms that often accompany Alzheimer's dementia. And we have no FDA-approved drugs for treating things like agitation. And so there are ongoing clinical trials that are testing compounds as potential treatments to just help memory be a little better, or to prevent or reduce the severity of things like agitation in patients with moderate to severe dementia. Now, there are hundreds of different drugs still in development as viable treatments for Alzheimer's disease at various levels of disease severity, and that's really exciting.
Another question, just going back very quickly to Aducanumab, was whether there's any known side effects of the drug.
Yeah, I saw that, and it's a really important question. And I've said throughout that we really are focused on whether a drug is safe and effective enough, and safety is paramount in clinical trials as well as we think about whether a drug should be approved. For the most part, the monoclonal antibodies that are in development for Alzheimer's disease that have been shown to reduce the amount or total burden of amyloid in the brain do have important side effects associated with them. These side effects are referred to as amyloid-related imaging abnormalities, or ARIA, A-R-I-A. It's something that can be seen on an MRI. It does seem to happen with essentially all of the monoclonal antibodies that reduce beta amyloid plaques in the brain at differing levels for the differing antibodies. The good news is that while this is a very common side effect for I should say that it's not terribly common. It ranges for the different antibodies, but for the most part, it is an asymptomatic phenomenon. So when patients develop these imaging abnormalities, we can see them on an MRI, but for the most part, patients don't experience any symptoms. When they do experience symptoms associated with ARIAs, there are things like headache and confusion, and more rarely there can be very serious sequelae of having ARIA, but that does seem to be in a minority of cases. So that's going to be very specific to the drug under study. And if someone were considering participating in a clinical trial of a drug that might cause ARIA, they would have the opportunity to talk with an investigator about how frequently those things appear to happen, the severity if they do happen, how often they have symptoms versus are asymptomatic.
There's a question here about whether monoclonal antibody drugs are being tested in individuals who have Down syndrome and Alzheimer's.
Yeah, so of course, Alzheimer's disease is a common phenomenon in patients with Down syndrome, and UCI is one of the real leaders with people like Ira Lott and Elizabeth Head and Mark Mapstone really blazing a trail in the science of Alzheimer's disease and Down syndrome. And importantly, there are clinical trials underway to try to combat Alzheimer's disease in people with Down syndrome. And many of the drugs that are in development for what we would call sporadic Alzheimer's disease, the Alzheimer's disease that affects older people who don't have Down syndrome, many of those drugs or those classes of medications are actively or in consideration for being tested in clinical trials in people with Down syndrome as well. Especially the anti-amyloid therapy. So it is definitely an important and exciting area of research that is being led by some of our best and brightest here at UCI.
I think we have time for one more question. And I want to address a couple of questions that are somewhat similar in nature. One is asking, if I have a parent or a family history of Alzheimer's disease, does that mean I'm going to get it? And then related to that, if I have a family history of Alzheimer's disease and want to participate in a clinical trial, why am I being told that I'm too young to participate at this point? Maybe you could address both of those.
Yeah, I'll try. So, who will and will not get Alzheimer's dementia someday remains an open question. We cannot predict with certainty who will and won't get Alzheimer's disease. We know a lot about risk factors, and risk factors mean that if a person exhibits a certain trait, they may be more or less likely than someone that doesn't exhibit that trait to get Alzheimer's disease themselves. So if you had a parent with Alzheimer's disease, you're a little more at risk to get it yourself than someone who didn't have a parent with Alzheimer's disease. The strongest risk factor for Alzheimer's disease remains age. The older we get, the more our risk for developing Alzheimer's disease goes up. And so we are hard at work to try to better identify and be able to predict who will get Alzheimer's disease and who will not. But we just aren't there yet. We have learned a lot, and we have whole other lectures on understanding your risk for Alzheimer's disease and trying to lower it. As far as, if you want to be in a clinical trial, Chelsea pointed out the C2C registry. And it's important to say that the single greatest and most consistent barrier to finding improved treatments for really any condition is that not enough people choose to participate in these studies of new interventions. It's actually the single most common reason that clinical trials fail. And if we could recruit to clinical trials twice as fast, we'd get answers to important questions twice as quickly and accelerate our overarching goal of finding better treatments. But we have to design those trials extremely carefully to make sure that we answer scientific questions. When I teach about clinical trials, I always like to say that there's a big difference between a failed drug and a failed trial. Drug development will include some failed drugs. Not every drug is going to work. What we can afford are failed trials, and those are studies that don't answer the scientific question, don't give us adequate information to know if a drug is safe enough or effective enough for use. And so by the requirement, the necessity of designing these studies very carefully, that includes that we have to think very carefully about which ages we're going to include in a specific clinical trial. And that's really about making sure we answer the scientific question. Over the last decade, I have seen especially prevention clinical trials for Alzheimer's disease get younger and younger. The most recent Alzheimer's prevention clinical trial will include people as young as 55 if they had a parent who had Alzheimer's disease before the parent was 75. So, we have gotten younger and younger, but for those 45-year-olds out there who want to be in a clinical trial, at this moment, we don't have anything, but it doesn't mean we won't someday start aiming even younger.
Thank you. That concludes our time today, Dr. Grill. Thank you. You are a wealth of knowledge and information on Alzheimer's and clinical trials and the drug development process. And we received so many great questions from our viewers today. So thank you for taking the time to join us and ask us your important questions. Dr. Grill, do you have any other final comments or?
No, I'm deeply appreciative of our community for joining us for things like this. We love bringing information to folks, and we know that we can't succeed in our mission without a really strong collaboration with the community at large. So I'm appreciative of folks for joining us today, and hope they'll take advantage of UCI Mindcast. Chelsea and others from our team have worked incredibly hard to create an entirely new resource that we're very excited about. So stay tuned. There is more to come.
Thanks, Dr. Grill. Take care. I just have a few more final announcements for all of you who are attending right now. Again, thanks for attending live. We are excited to announce the launch of our new video and podcast library, which we're calling UCI Mindcast. And that's where you can access educational content, including past Ask the Doc episodes like this on our website. And the website address there is mind.uci.edu/mindcast. So we hope you can join us for future Ask the Doc episodes, which this year will be held on the second Thursday of each month at noon, so same time as today. And next month, we will actually be featuring, there was a question about Down syndrome and Alzheimer's, and next month we will be featuring a special focus on Down syndrome and Alzheimer's disease research with a panel of experts from UCI Mind, Dr. Ira Lott, Dr. Elizabeth Head, and Eric Duran, and that will be held on February 11th. So please tune in to learn more and ask questions. In the meantime, to learn more about research at UCI Mind, you can visit our website, or again, the UCI Consent to Contact registry that we mentioned to learn more about studies that might be right for you. Please take care, and we hope to see you next month on Ask the Doc on UCI Mindcast.